I made it to the Katzmann Breast Cancer Center and was excited to meet Katzmann's Center Director and Chief Surgeon, Dr. Susan Beck. It's really comforting to know that there is a special place women can go for prevention and treatment. Plus, the Katzmann Center is an all-in-one facility that can help women before, during, and after diagnosis.
Hey, Cam.
Hi, Dr.
Thanks for
Beck.
coming to the Katzmann Breast Center.
Thank you, and thank you so much for having us here.
You're welcome.
Well, you have so much to share with us, and we want to hear all about everything that you're doing here that is helping women all across the state.
Well, thank you. And this is a wonderful center, and we'll go in shortly and walk you through what a patient has to go through when they come here.
And I would like to ask that as a woman, and if I were coming here for the first time, I know I would be filled with so much anxiety and concern. What do you do, and how do you handle a woman coming through those doors for the very first time?
Well, first of all, Katzmann Breast Center is a very warm and loving environment. I just want you to know that we see over 2,000 to 3,000 patients a year at this center, and the majority of them do not have breast cancer. And they may have other issues that we can help them work through, and we try our hardest to make it a non-scary but very comforting visit.
Well, that's reassuring, and I think that's important to note that all women, when told to come to the center for testing or just to see you, does not mean they have breast cancer.
That is correct.
So,
we see only about 200 to 300 a year.
Great. So sometimes concerns aren't always what we make them out to be.
That is correct.
So thinking positive.
Yes.
Yes, let's go in.
All right. Welcome to the Katzmann Breast Center.
Wow, how nice it is, too.
This is our reception area.
Okay.
This is Kara.
Hi.
Hi.
Beck and Tam. Nice
Yes.
to have you here.
Thank you.
Welcome to Katzmann Breast Center.
Thank you. I'm glad to be here.
We're able to meet and greet patients as they come in here in a very warm environment.
It is warm, and I think sometimes when you're in a medical office, the environment alone creates anxiety. So to have some soothing, peaceful, beautiful decorating and colors, that's already putting me in a better feel.
And then definitely some rest in here until we're ready to receive you into the back rooms, which we can walk back in there now.
All right, you lead the way.
So as we come here, you can see that nice warm feeling, the curved walls. And then this would be an example of one of our exam rooms that we have. And as you can see, when you come in, certainly we'd always like to have more space, but this certainly allows family to be present.
Sure.
This room in particular has some of the instruments that we use for special procedures, so minimally invasive biopsy. So this would be our procedure room here, and we have plans for future expansion. We would have just a few more rooms that have that availability, where we have our ultrasound, which allows us to do ultrasound-guided minimally invasive biopsies. So the consultation may not be much more than an exam and a plan of action. Sometimes it can proceed to a biopsy, but sometimes it can just be reassurance, reviewing all the tests, and letting the patient know exactly what she has. And again, the majority of time, benign diseases is what is found. As we leave the exam room, oftentimes then, if a patient was found to have a very worrisome lesion, and we had either performed a biopsy or made a plan for surgery, we would have the patient and the family come into our consultation room here. Okay. So they would come in and be with their family, and so they see several faces, and they have several ways to interact with the staff so that all their needs can be met.
All right. Sounds very comprehensive, that all needs are met here. Emotional, physical, as well as just overall well-being.
Well, and that's what we strive to do here, and certainly in this area we do the majority of our work in making plans and figuring out what we need to do as far as testing and treatment. As we come over here to this corner, This is where we share space with our radiology colleagues, and this is what is called a stereotactic biopsy. And this table is using, instead of ultrasound, using X-rays, radiation to evaluate the breast and to find the abnormality, and stereotactically, meaning from 3 different coordinates, being able to find and remove an abnormality within the breast. It's very specific.
Okay.
So it is a very comfortable approach.
Sure.
And oftentimes what we'll do here at the Katzmann Breast Center is we will give the patient, before she comes in for one of these biopsies, which is oftentimes scheduled within 24 to 72 hours after their initial visit, some pain medication and a muscle relaxant.
Oh, okay.
So as they lay on their stomach and in a position they may not be necessarily comfortable with,
Right.
they'll be relaxed and pain-free.
Dr. Beck and I had a wonderful afternoon, and we could have made this episode of Metro Woman a 2-hour special. She has an incredible passion for people, and it was great for me to meet this inspiring woman and accomplished surgeon. You have covered so many fabulous and interesting facets of your center here, but I would like for you to share with our audience, what are the main things women today must do to prevent and to be aware, to be on top of breast cancer?
Well, that is an excellent question, and certainly this month it really helps to review that.
Exactly.
And of course every month. But the one thing is, be self-aware of your own body. That is so important. It is good to do a self-awareness breast exam, and it's best to do that especially for young women that week after their menstrual period.
Oh.
So that is a good thing to do, especially in that 20 to 30 year old age group and beyond. But especially in that younger age group where you're not really thinking of breast cancer, and it is fortunately not very common in that age group, but it's still good to be able to be self-aware and make
it a habit.
Make it a habit,
of
yes.
exam.
And when going for your pap and pelvics, that a breast exam would be performed at that time as well.
Sure.
And then basically your baseline mammogram, as recommended by the American Cancer Society, should be at age 35.
Okay.
And then we usually wait till age 40 to go every 1 to 2 years with mammograms. Definitely clinical breast exams every year. What does a clinical breast exam mean? That means going in and having your physician do a breast exam.
Okay.
Because they can push harder and than you can, and they can have an idea of what isn't maybe necessarily normal, and actually find lesions at an earlier and smaller stage than you may be able to find it yourself.
Right.
And then certainly at age 50 and over, as women age, we increase our risk for breast cancer. And some of that has to do with just the hormones that have been circulating for a long period of time, the length of time that you still have your periods, how old you were when you first started your period, and if you ever had kids.
Sure.
So all those things are very important. Now, there's some studies out after the age of 79, the statistics as to should I continue to have mammograms yearly. That is certainly up for debate, but certainly, as you know, age, someone at age 80 may be different than someone else at age 80, and so it has to do with their overall quality of life and their overall health.
Sure.
And if they are very vibrant and healthy, then we usually recommend that they still come and see their physician for breast exams and consider a mammogram yearly.
Exactly. Well, I know you've helped me, and I'm sure you have helped many, many other women today. So thank you so much for your time and for sharing this beautiful facility with us and with all the people and women of Iowa.
Thank you, Tam.
Thank you, Dr. Beck.